Okay. Hello, guys. My name is Elena Harper. I am a health educator and a contractor with Precision Stewardship. What if every hospital in Shelby County had the right tools to prevent infections from becoming harder to treat? At Precision Stewardship, we help hospitals establish antimicrobial stewardship programs, ASPs, which are plans to guide providers in using antibiotics safely and only when necessary. By partnering with us, you could save up to $900,000 a year and decrease antimicrobial disease mortality by 18%. All right, now let's start from the beginning. What is antimicrobial resistance? Antimicrobial resistance basically happens when bacteria become ineffective to the medicines used to kill them. This happens mainly in two ways. There's a lot, but the big two are overprescribing and misuse of antibiotics. What this kind of looks like is overprescribing happens when people either don't follow guidelines, when patients have like when they're in the visits, there's like time constraints because you don't see them for that long of a time, so people can get misdiagnosed or maybe the wrong dosage of something, and just in general, like low public awareness of this problem. Now, misuse is a bit more jargony, but misuse of antibiotics, one of the big ones is people use antibiotics for viral infections, and the makeup difference between bacteria and viruses are a little bit different. One is like has a cell wall and basically one doesn't. And the medicines, like when it's trying to find something, it can't really kill something if it's not really finding what they need to find, which that's what happens with viruses. It doesn't kill what needs to be killed. Um, Anyways, I digress. The other big one that's on like the patient side of misuse is the main two is people not finishing dosages. That's why it's so important to like finish your full medication even if you feel like you're better, and also either skipping or not taking them in the right timely manner as per prescribed. And don't even get me started on people who start taking medications that they're not prescribed. Well, the CDC stated that over 2.8 million people are affected by this annually, and if this doesn't become fixed, we're in a huge trouble basically. It's already a global issue. It's one of the hot topics seen and heard of today. If this doesn't get dealt with or anyone like steps up, basically what's going to happen is we're going to live in a pre-antibiotic area where minor issues and like injuries become like like deadly. Like it's not going to be fun because there's nothing to treat it. Now that we've gone over what AMR is and how big of an issue it is, what can we do about it? Well, Shelby County stands out because Shelby County has several hospitals that do not have stewardship programs that help ensure antibiotics are used safely and only when necessary. This is where we step in. Who are we? We are Precision Stewardship. Here at Precision Stewardship, we believe in precision in all things, especially when it comes to antimicrobial resistance programs. We educate and contract. We are an education and contracting organization that supports hospitals in building long-term stewardship programs. We offer tools like ASP workshops, virtual and in person. We have guided materials, education materials that are easy to understand. We train staff and implement like policies and procedures in hospitals and things like that. Basically, all we do is we educate, create, and implement clear steps that help in our mission to lower antimicrobial resistance. Our target audience. So, there's two big hospitals in this specific Shelby County region, and they do not have ASPs. So our target is those hospitals specifically, but even more specific, the physicians within those hospitals. The reason why we care about the physicians directly is because not only are they ones interacting with the patients, they're the ones prescribing these patients antibiotics, what kind, how much, yada yada. So they're like firsthand, hand-on seeing and doing, like dealing with this issue. Our other target is hospital decision makers. Basically, these are the ones, or they're in charge of what happens in and outside the hospitals, what policies they abide by, rule changes, things like that, what systems are allowed in their hospitals, and so forth. And then my last one is medical directors or medical educators at UTHSC, and basically it's a local medical college. We thought this was a good audience because these are the future healthcare workers of this area. Okay. Now, with this target area, we obviously have some costs and some benefits. And they're kind of in order, and I'll state them as we go. The cost for physicians, time and discomfort is going to be a big thing. Time is going to be a big thing across like many people's platforms because it takes a lot of time to implement procedures, change policies. You know, everyone's been doing their way for a while. It's kind of new to adapt new ways and rules and settings. Also, speaking of settings, like it's going to be a little bit discomforting because you're going to have like new staff members that maybe you don't really know and might clash a little bit from what you know. So that's one for them. Then for the decision makers, we have again time. That's going to be a big one across all of them. But we also have training. It's going to take time and effort to like train staff, members, get everyone on board and stuff like that. And obviously with this audience, money is like a big factor for them. They care about money in their pocket. They care about money that they lose. It is a little bit money up front, but we'll get back to that in a bit. With the educators, teachers, admins, stuff like that, obviously re-educate. We'd have to be changing their criteria, so updating lesson plans. And I know for teachers, that's not really like a fun thing to do, and it's very tedious, but it's for a greater purpose. I swear. Benefits. Okay, so the benefits of each one, you can see there's a lot more benefits outweighing the cost. For the physicians itself, we have recognition. Getting an ASP program, you're gonna get that recognition across like the board. Like when we saw that little chart, people either met or unmet, they're gonna meet it after this. They're gonna have a better system flow and just an overall more efficient prescribing method in general. For the policymakers, decision makers, the big guys, talking about money, this is where we start rolling in more money in the end. It's gonna attract way more investors. They're going to not only have fewer readmissions, but they're also going to increase patient satisfactory rates and outcomes as well. And then educators, obviously, you know, teachers care about like educating like their students best to their ability to like enter the workforce, work field, whatever. And for this specific school, it's a medical school, so this is like very up their alley anyways. So they're going to get better educated students, and they'll be able to contribute to improved long-term community health. Now, let's look at our goals in reaching these said groups. First of all, we want Dr. Wilson to be a guest speaker. Dr. Wilson, if you don't know who he is a Tennessee Department of Health entity. He is employed and he's employed over them or with them, and he works with our initiative in antimicrobial resistance. He's been there for over 5 years. He already works with programs and organization, and he's already like a guest speaker, like in his position and title. But we'd love to have him on our side and kind of like be a voice like through us or like help us in that sense. Get him on our side basically. We would love to have eMed workshops and events, both virtual, hybrid, online, all that kind of stuff. If you don't know what eMed events are, they're basically like a Facebook but for medical events. Our workshops would consist of basically just like teaching awareness, the importance of AMR, and all that kind of jazz. We want to start our social media campaign. We want engaging Facebook, Instagram posts, like all around social media to kind of like encourage involvement and awareness of who we are and the said issue. With that being said, the last one is our brochures. We will be distributing pamphlets to our target audience, and also just in general, just like spark overall like local interest, kind of get the ball rolling, and kind of starting there. And then here, the next slide, I'll show you all the materials we created to start this plan. So for my marketing materials, we have, like I said, social media campaign. That's a big one. I know it's small. I'm so sorry. But it is a elaborate 2-week plan of types of social media posts, what would be in the kind of post, kind of like a mock trial, like on pen and paper of what that would look like in depth. Then brochures, that was a big one to kind of like get the ball rolling, get our names talked about, getting that to our target audience. Here is like a mock version of that. As well as my visuals, I also have a summary of the result of my focus group improvements. I know one of the big ones was color scheme and overall like updating all my images to kind of like be uniform, be professional. I chose like to have things a bit more like in a uniform sense. I also added a bunch of like content as well, that was more like easy and accessible to like read for people and like understand. So I added a definition of what AMR is. I even added like accredible sources, like through the CDC. There's a quote in there. I even added like upcoming events on my brochure as well. So just an overall revamp, looks completely new from the old one. Thanks to all those revisions that I did, we feel that we are now ready to be launched into the world. And that brings me back to why all this matters in the first place. As the CDC's number continues to rise, antimicrobial resistance isn't slowing down. This is something that needs to be addressed now, not later. And with that, I'll leave you all with this. Precision today protects patients tomorrow, starting right here in Shelby County. Thank you so much. These are my way of contacts if you have any questions, comments, and or concerns. And I have a lovely little QR code for all my little social medias. Thank you so much.